Our first speaker in this session is Dr. Peter Down from the University of Nottingham. He's a clinical lecturer in the University of Nottingham. He recently completed his PhD in the cost effectiveness of mastitis treatment and control. And his presentation here is a cost effectiveness analysis of on-farm cultures for the treatment of clinical mastitis in dairy cows. So over to you, Peter.
Okay, thank you very much. Thank you for the introduction, Mr. Chairman, and thank you for the invitation to be here. It's a great pleasure. So I'm going to present a bit of work this morning from the aforementioned PhD, looking at the cost effectiveness of on-farm culture for the treatment of clinical mastitis in dairy cows. So thanks to the previous speaker, I don't need to say too much about this. I'm sure most of you are aware by now. By on-farm culture, I'm referring to the system whereby all mild and moderate cases of clinical mastitis are sampled and cultured at first presentation on farm, and then cases are treated selectively based on the results of those cultures, usually about 24 hours later. And typically, there are different ways of applying this technology, but typically gram-negatives and no growths would not be treated at all with antibiotics, and those cases yielding a gram-positive or a mixed infection would typically be treated as usual. So just to run through some of the pros and cons of this system. Obviously, the benefits of on-farm culture are a reduced antibiotic usage. We saw on the previous presentation that there's a large scope of reducing antibiotic use. And if we think about the fact that mastitis accounts for the vast majority of antibiotic usage on most dairy farms, you can probably appreciate what scope there is there. And also, it represents a more responsible use of antibiotics by targeting our antibiotic treatment at the gram-positive pathogens and withholding antibiotics from gram-negative pathogens, which is a little bit harder to justify. We're therefore using antibiotics in a more responsible manner, which is quite a topical at the moment. There'll obviously be less discarded milk, because if we're withholding antibiotics from a proportion of the cases, then their milk can be put back in the tank sooner, potentially, once the clinical signs have gone. And it's pretty quick. 24-hour turnaround isn't bad for culture. So all in all, there's sort of some of the key benefits. There'll obviously be more. So we think about some of the costs, some of the downsides. Well, there's clearly going to be some equipment costs. There's the plates themselves. But equally, there's then some incubation equipment and other lab consumables. And then there's this delay in treatment. And as the previous speaker alluded to, there may be some concerns about that by farmers and the veterinary profession, this delaying treatment by 24 hours. And then there's also the risk of misdiagnosis, so no culture system is going to be perfect, and it's also going to be reliant on the people that are reading these plates on farm. There's going to be some variation in that, some uncertainty, and mistakes will be made. And there's a potential for worse outcomes clinically with the cows that are treated by this way, and I'm going to come into this a bit more in a moment. So, one of the key papers, as has been already mentioned, is this study by Lago et al. In 2011, where the sort of use of on-farm culture was compared with a more conventional approach, and in a selection of herds in the USA. Some of the key outcomes from that paper, you can see that the percentage of cases treated with antibiotics in the conventional way was 100%, as you'd expect, whereas in the on-farm culture cases, about half those cases were treated with antibiotics. Very little difference with respect to days out of the tank and days to clinical cure between the two approaches. But it's this one, the bacteriological cure, which was more interesting. Whilst there is no statistically significant difference, there is quite a difference numerically. There's from 71% for the conventional system and 60% for the on-farm culture approach. And this raises some interesting questions. So whilst it's not statistically significant, what about the clinical significance of this difference? And is it economically significant? So the aims and objectives of this study were to explore the factors that influence the cost effectiveness of an on-farm culture approach, And also then, one of the key objectives really was to try and identify the herd circumstances under which OFC was likely to be more cost-effective than a conventional approach. So to do this, I've used a methodology called probabilistic sensitivity analysis, which is a bit of a mouthful. It's a system that's widely adopted by the human healthcare sector for the analysis of cost effectiveness. And you can see, if you look at the sheer volume of publications in the human medical field in recent years, you can see that since the sort of early 2000s, there's been a real boom in the use of this methodology. The key features of probabilistic sensitivity analysis is that all estimates of input parameters in the model are specified as full probability distributions, and therefore we're capturing some of this uncertainty that surrounds the parameter values. This uncertainty is then propagated through the model so that imprecision in parameter estimates is transparent. Due to the limitations of time this morning, I'm not going to be able to go in great detail as to all of the parameters for the model. However, the model that I've used in this presentation today is an adaptation of a model I've previously published, which is this paper here, Rate of Transmission, a Major Determinant of the Cost of Clinical Mastitis. So I'd urge you to go and look at that if you want a bit more detail about the full parameters used in the model. I'm going to talk briefly about the sort of OFC-specific parameters, which were taken from the Lago study where possible. So that includes the proportion of gram-positive cases, and I've used a distribution there from 10% up to 90%, again based on the results of that Lago study. And then a distribution for the reduction in bacteriological cure rate. So again, the average figure was 11%, and I've put a distribution around that to try to capture some of this uncertainty in this reduction in bacteriological cure rate. So that ranges from no difference at all up to a 22% reduction in bacteriological cure rate. I've then put in distributions for the cost of the plate and the time taken to culture, which was just based really on current retail prices and expert opinion. I'll quickly talk you through the framework of the model, just to give you an idea. So all cases would follow these routes, irrespective of which group they're in. So it would start off with a case of clinical mastitis here, and that case would be treated or not, depending on whether it is OFC or conventional. And from there, it can go one of three ways. We can cure completely, so we can cure bacteriologically and clinically, and we can then end the lactation or be culled prematurely. The case could cure clinically, but remain bacteriologically infected. Or the case could fail to cure altogether, in which case it would receive another treatment of whatever it received here. And there are different routes here that it can follow, and these are all governed by probability distributions in the main. And another feature of this model is that you'll see that cases that remain subclinically infected have a risk of transmission to herd mates, which again is governed by a probability distribution ranging from a very low risk of transmission up to a very high risk. So we can explore lots of different scenarios. Okay, so a stochastic Monte Carlo model was developed, and with this we simulated a case of clinical mastitis at the cow level and calculated all of the associated costs. We modeled 5,000 cases of clinical mastitis simultaneously for both conventional and on-farm culture approaches. And then Spearman rank correlation coefficients were used just to explore the relationship between the model input parameters and the difference in cost effectiveness. That was the outcome of this model, is the difference in cost effectiveness between conventional and an on-farm culture approach. So here's some of the Spearman rank correlation coefficients, and as you'll see on here, it was the proportion of gram-positive cases, so that's effectively the proportion that are treated with antibiotics, and the difference in bacteriological cure rate, which came out to be the biggest sort of drivers of this difference in cost effectiveness. The cost of the plate and the time taken to culture had very little impact on the overall difference in cost effectiveness. And here's a graph just to break that down a little bit further. Across the bottom is the proportion of gram-positive cases. So again, you could think of this as the proportion of cases that would have required antibiotic treatment across the bottom, ranging from sort of 10% up to 90%. And then up the y-axis here, we've got the difference in cost. And a positive figure means that the on-farm culture approach was more expensive. So you can see that when you treat overall, when you treated very few clinical cases with antibiotics, then there wasn't really very much between the two approaches. However, as the proportion of cases that you treat, the proportion of gram-positive cases increases, the probability of on-farm culture being more cost-effective was greatly reduced. However, what this graph doesn't really tell us is the variation within these bars with respect to what impact this reduction in bacteriological cure rate has. So to do that, we've sort of subdivided the cases into cases where there was a very small difference in bacteriological cure rate, so ranging from 0 to 5% reduction, a group where there was a moderate difference, so 5 to 17% reduction, and then a group where the cases where there was a large difference, so 17 to 22% reduction. And then if we look at the same sort of graph with those cases divided in that way, we see a slightly different story emerging now. So we can see that provided you weren't treating any more than about 50% of cases with antibiotics, and provided the reduction in bacteriological cure was no more than 5%, then on-farm culture would be more cost-effective in approximately half of those cases. So you can see here that this represents the cases where on-farm culture was more cost-effective. So effectively, we've got a high proportion of gram-negatives, and we've got a small difference in bacteriological cure rate. If we go into the cases where there's a moderate difference, slightly different story now. So again, you can see here that really on-farm culture was only more cost-effective in herds that have a very extreme gram-negative profile, very few gram-positives, in which case OFC was likely to be more cost-effective, but otherwise the conventional approach was likely to be more cost-effective. And then in the cases where there was a large reduction in bacteriological cure rate in the on-farm culture approach, there were no scenarios really where on-farm culture would be more cost-effective, as you'd probably expect. So some of the key messages then. Reduction in bacteriological cure rate and the proportion of gram-negative cases will have a fundamental impact on whether OFC will be more cost-effective than the conventional approach. And therefore, OFC will probably not be cost-effective for many herds. So we should be adopting this technology only after careful consideration of the predominant pathogens present in each herd. And we should be having an honest discussion about this uncertainty that exists surrounding its overall cost-effectiveness. Now, I know the convention is for you to ask me questions, but I thought I'd finish with a few of my own to get the ball rolling. And maybe we could carry this on in the bar later. If we do find there is there are worse clinical outcomes when using on-farm culture, does this represent a responsible use of antibiotics? Are poorer clinical outcomes a price worth paying for reduced antimicrobial usage? And if so, who should bear that cost? Should it be the farmers? Should it be the milk buyers? Or maybe the consumers? That's enough from me. Thank you for listening, and I'm happy to take any questions. Thank you.
Thanks very much. If you have any questions, could you make your way to a microphone here in the auditorium, and Peter, I'm sure, will be glad to answer them. Any questions?
Yeah, Peter, I was intrigued that treatment was antibiotics, but consideration of anti-inflammatories, non-steroidal anti-inflammatories for outcome and in the whole mix. Have you thought of that as far as,
Yeah, it'd be a nice continuation, wouldn't it? It hasn't featured in the model because I was using data from that's been published, basically, and there's very little to draw upon with respect to on-farm culture, so I was very limited, really, to that sort of Lago study that I referred to, and non-steroidals didn't really feature in that, so it'd be hard at the moment to draw that in, but hopefully, as we get more research on this area, we can start doing a bit more with that too. I think it'd be a very good continuation, absolutely.
Have you got a gut feeling as to how it might affect the cure
Well,
rates?
there's growing evidence for the use of non-steroidals with respect to udder health and you know, the outcomes post-treatment. So, you know, I suspect it's like, you know, as that story develops, we're likely to see, you know, benefits for the use of non-steroidals, and you know, I think more and more research that's done, they're seeing, you know, a better story for the use of non-steroidals and a better case for them. So yeah, I think my own gut feeling would say that there will be a role for non-steroidal use in clinical mastitis, definitely.
Thank you.
Okay, thanks very much. If there are no more questions, we'll move on to our next speaker. Thank you.
Thank you.
Just one more.
Just
What about you just looked at the individual cases of clinical mastitis and the outcomes, but doing regularly this on-farm culturing may lead to a completely different thought of approach of the farmers and the people involved in all the treatments, so they may have better knowledge on their herds afterwards, and that may have beneficial effects that Lago probably didn't record or see or whatever. Don't you think that this would be an interesting idea to follow this road up? So what happens if you do regularly on-farm culture to your knowledge about your herd and to the treatment decisions that you take, not only for the individual case, but in the long run for your herd?
Yeah. You know, I think absolutely right. I think that's a real positive, really, is that if we're getting farmers to discuss and think about you know, treatments, antibiotic use with respect to clinical mastitis and growingly selective dry cow therapy as well, I think that's got to be a really positive thing. I guess the concerns with respect to on-farm culture as it is that there does appear to be this discrepancy in bacteriological, in clinical outcome, and we don't yet really know what's driving that, and therefore we don't really understand how best to mitigate it. And so I think we need to be having an open conversation about the fact that there's still quite a lot we don't really know about it. But I would always be very keen to be having these conversations. I think there's a lot you can learn from looking at the data with respect to the behavior of pathogens, even if you're not culturing them, because, I mean, culturing pathogens doesn't necessarily tell you how they're behaving on the farm. So I think we need to, you know, bear that in mind as well, and always be looking at the data as well as what bacteriology we're getting. Yes, I think any conversations we're having about, you know, targeting antibiotics at the right sort of cases, I think, is a positive one.
Okay, thanks very much.
Okay, thank you.
And we'd like to thank Peter for his talk and answering your questions.